Some of them are tonight still insisting the late Ted Kennedy would have sold out the public option, trusting their own propaganda instead of a letter written by the dying senator to the Pope. In our fifth story in the countdown, any pretext of bipartisanship or negotiation over health care was finally thrown under the bus by at least 4 Republican senators, including Mr. Grassley of Iowa, the one putatively leading the bargaining, obviously bargaining with the sincerity of the 2 Japanese diplomats who went to the White House on November 17, 1941. What would Teddy do? The liberal lion of the Senate having answered that question himself during, as it turned out, his own burial service on Saturday night with a letter to the Pope that was personally hand-delivered by President Obama earlier this summer. His words read in the fading light beside his grave by Cardinal McCarrick, the Archbishop Emeritus of Washington.
Even though I am ill, I'm committed to do everything I can to achieve access to health care for everyone in my country. This has been the political cause of my life.
If somehow that directive were not clear enough indication of Senator Kennedy's intentions, earlier that day, in his funeral in Boston, Senator Kennedy's grandson Max having offered this prayer.
For what my grandpa called the cause of his life, as he said so often, in every part of this land, that every American will have decent quality health care as a fundamental right and not a privilege. We pray to the Lord.
Senator Orrin Hatch in the Mission Church of Boston to hear young Max Allen's prayer, but despite that, the following morning, Senator Hatch claiming that Senator Kennedy would have compromised on the political cause of his life.
When he recognized that, you know, he couldn't get everything that he wanted, but he could get a good bill. By working with the other side and making true compromise, he would always come through.
So you think he'd move in that direction?
I have no doubt about it.
You're the only one. In Salt Lake City Friday, 2 days after Senator Kennedy's death, Senator Bennett having stated at a fundraiser where the fundraising headliner was Karl Rove, quote, the #1 assignment in 2009 is to kill Obamacare. Senator Barrasso of Wyoming having declared the same day that it is time to kill the bill. The bulk of the negotiating that remains being conducted by the Senate Finance Committee, including Senator Grassley, who we learned today sent out 3 weeks ago a fundraising letter in which he, quote, set the record straight on my firm and unwavering opposition to government-run health care and asked for immediate support in helping me defeat Obamacare, and claimed that if the legislation sponsored by Chairman Ted Kennedy in the Senate is passed, it would be a pathway to a government takeover of the health care. Lawrence O'Donnell, who served as Chief of Staff to the Finance Committee. Lawrence, good evening.
Good to be here, Keith.
The Grassley letter prompting a question that takes on more outrage and more urgency with each revelation about this man from Iowa. Why is any Democrat still negotiating with the Republicans, and particularly with Mr. Grassley, whose word seems to mean absolutely nothing?
Well, let's see how much they really are negotiating with him when they get back from the August recess. That fundraising letter, I think, is the most devastating comment so far. Obamacare is a very broad term that I think, to the recipients of that letter, means any form of health care reform. So that's as bad a thing as we've heard from Grassley so far.
The notion, meantime, floated by people like Mr. Hatch and other Republicans playing on this perpetual loop at Fox, on right-wing radio, that Senator Kennedy would have compromised on the current health care reform bill, particularly regarding the public option. You worked with Senator Kennedy on the Clinton health care reform bill process as somebody who was in there and who now I presumably heard the senator's letter to the Pope right after the senator's death during his burial. How do you respond to this notion from Mr. Hatch?
Well, I would not presume to speak for the senator that he's no longer with us. I think John Kerry can do that. I think Chris Dodd can do that because they had conversations with him specifically about where he stood on it this year. What we do have is the history. There's a history of absolutely no compromise with Ted Kennedy on health care reform and on the central principles of it. He refused to compromise with President Nixon when President Nixon offered a very, very strong employer mandate bill, which was basically the shape of the Clinton bill 20 years later. Ted Kennedy came to regret that. He told E.J. Dionne by 2004 that, in fact, he did regret not doing business with Richard Nixon. But after that, he became very unyielding also when President Clinton wanted him to be unyielding, which was in 1994. You'll remember President Clinton held up a veto pen and basically said, I'll veto anything that does not have universal coverage, and the mechanism for that was the employer mandate. The employer mandate was the tough get in that legislative go-round. That's what we couldn't get past. Ted Ted Kennedy did get the employer mandate passed in his committee with no Republican votes, including Orrin Hatch. He did not compromise any of the central principles of the bill to get Orrin Hatch's vote. Same thing happened this time around. Chris Dodd was in close communication with Chairman Kennedy about what to do. When Chris Dodd passed the bill out of the committee with 0 Republican votes, with Orrin Hatch voting against it and with John McCain voting against it, Ted Kennedy called him the next morning first thing and did not say to him, "Why didn't you get Orrin Hatch?" He called him to congratulate him for the way he passed the bill and what was in it.
You said at the start, let's see how much negotiating the Democrats actually do after the break is over. In the Republican radio address over the weekend, Senator Enzi, who's also supposed to be part of these purportedly bipartisan talks, said the Democrats and their health care proposals will actually make our nation's finances sicker without saving you money. He said they would raid Medicare, and he said they would intrude in the relationship between a doctor and a patient. Mr. Gibbs this afternoon at the White House said that those remarks were illuminating. Is his response illuminating as to where the White House may have finally come down on this? Did they finally get it at the White House?
I think they should be counting Enzi out. I mean, how you could ever imagine the Republican from Wyoming being on board something like this always surprised me. He, too, was on the Kennedy committee. He also voted against the Kennedy bill. He also did not engage in negotiations with Chris Dodd on that bill. And now he has been involved in the Finance Committee negotiations, which have been looser, they've been more open. But I never saw a route to getting his vote on what the president wants, which is this public option and other elements, and I don't see it now. And so the White House, the problem for the White House is this is very bad news when they get to the end of the August recess and they realize there are no Republican votes, if that's what they're realizing, because they did not have a strategy prior to now to do this without
is what can Democrats really get done on this age-old American political problem if they've got 0 Republican votes? Joining us now is a man who caucuses with the Democrats, but who is a proud independent from the state of Vermont, Senator Bernie Sanders. Senator, thanks very much for coming back on the show.
Good to be with you, Rachel.
Let me ask you to dispute my premise right off the bat. Do you think there are 0 votes for health care reform among Republicans in the Senate?
Rachel, I believe that for many, many months, and it's sad to me that it took the administration that long to finally catch up with what reality clearly is. The Republican Party today is enormously obstructionist. They have no desire to address the enormous crisis that the American people are facing in health care, with so many people uninsured, underinsured, 1 million people going bankrupt. You know, you talk about death panels, 18,000 people a year die because they don't get access to a doctor when they should. So, no, it doesn't surprise me that the Republicans have not come on board. I don't believe they ever had any intention to.
The last time you and I spoke, you said that if Republicans were going to stonewall on something like the public option, you could support using budget reconciliation rules to beat a Republican filibuster, to pass health reform without any Republicans. Do you think that is going to be the way that this moves forward?
Well, I think there are 2 things that have to be done. Remember, in the Senate, we have 60 people in the Democratic caucus. That, in fact, once Massachusetts sends us another senator, that is enough to beat back Republican filibusters. And every Democrat in this country must demand that every member of this caucus stand firm against Republican filibusters. And then we can develop a strong health care reform plan which focuses on prevention, which increases primary health care, which makes sure that every single American has coverage, which begins to deal with the absurdity of the insurance companies cutting people off because they have pre-existing condition or because they got sick in the previous year. So I think what we need to do is get 60 votes to stop the Republican filibuster, and where we can, and it's a little bit tricky, but where we can, certainly use the reconciliation package.
So just to be clear, you're separating the issues of cloture, the filibuster, and the bill that's actually voted on. So conservative Democratic senators like Mary Landrieu and Ben Nelson, other people who have not said that they would support the kind of legislation that you would, for example, you're saying that activists who want health reform should pressure them to vote no, to stop the Republican filibuster, and so that there can be an up or down vote on the bill.
Absolutely, because it's a lot easier to go forward in a comprehensive way through regular order, and that means stopping the Republican filibuster and then bringing forth a vote. And as I've said many times, if some of the conservative Democrats don't want to vote for final passage because we have a strong public option, because we're taking on the insurance companies and the drug companies, fine. All we need is 50 votes votes plus the vice president. So that is the preferred route. If you can't do that, then you use reconciliation. That is a harder approach to bring forth comprehensive reform.
I guess, and this is, I'm outside the Senate, I'm outside Washington, and I don't know how the politics of these things work, but I'm guessing that since there has been a de facto 60-vote rule to get anything through the Senate in recent years, since the Republicans have been in the minority, and the Democratic leadership has not made a ton of noise about that, I'm guessing that they are not interested, they're not inclined toward trying to hold all the Democrats together to stop that Republican filibuster. Are you getting any support for this idea?
Well, Rachel, we are. I mean, it's been hot and cold. The leadership on occasion has made it clear that they expect everybody to vote against the Republican filibuster. Unfortunately, the next day, sometimes there has been a reversal on that. But I think the bottom line is what we need is the president, we need the Democratic leadership to be articulating very clearly what real health care reform means. Take on the right-wing echo chamber, which is lying and distorting what we are trying to do